Okay, so a very warm welcome at Mad Medicine. So this will be part 2 of the ANC history and examination. Let's start with the menstrual history. So what all we have to ask in menstrual history? The age at menarche, then about the cycles, are they regular? What is the duration of cycles? Amount of blood loss by the number of pads used per day, any history of clots, any cramps, or any other complications or specific menstrual problems. Then in menstrual, ask about present menstrual history and past menstrual history. Present menstrual history, as we know, it is within 6 month duration. Okay, present menstrual history, that means if the woman has come today, so within 6 months, before that, in the previous 6 months, that will come under present menstrual history, and anything which is earlier than that, that will be the past menstrual history. So separately ask about present as well as past menstrual history. Then coming to the past history itself, past medical history, surgical history, and any blood transfusion. Then comes family and family history, all the diseases, contacts, family history of twins, or if there were any obstetric complications in the family, that too you can ask for. Then comes the personal history. Now, first comes diet. In diet, you can ask about the type of diet. Is it veg or is it non-veg? Then you can make a table over here also, like I told you in the first trimester. You can make either over there or here in case of personal history. Under personal history, raw table, asking for the nutritional intake and calculate the calorie deficit and protein deficit. Then at this point you should counsel the woman also, right? Then comes your appetite. Is the woman having a like reserved preserved appetite, or has it decreased, has it increased, any changes, or any inclination for certain types of foods or liquids. Then comes bowel habits, bladder, and addiction, sleep, allergy, as well as contraceptive methods used are also a part of personal history. Then comes the examination. So in examination, first we start with the statement that my patient is well oriented to time, place, and person, comfortable, or it can be irritable, cooperative, sitting, or lying, like that. You have to write, okay, what is the position of the patient in examination? Was it supine? Was it lateral decipitous position? Was it a sitting position, standing position, everything? Now comes the vitals after this. Okay, so general, well oriented, all this. Then do the this one. After this, you have to do the general examination also. Right? What is general examination? From head to toe, a basic head to toe examination you have to do, writing everything starting from hair, then forehead wrinkles, in the eyes look for pallor, icterus. Then in the nose you can check for any septal deviation, any discharge. In the mouth, orodental hygiene can be looked for, and in the tongue you can look for again pallor or cyanosis. Okay. Then in the neck we can check for cervical lymphadenopathy, axillary lymphadenopathy, and all these things. Okay, then after that you can go for the pedal edema, right? And clubbing in the nails. So after doing all this, then what we do is general. So this was the general examination. Also means take an account of all the vitals, your heart rate, respiratory rate, blood pressure, as well as temperature. So comment upon all four of the vitals. After that, you can start with the examination, that is systemic examination. You can do quickly examine each and every system, CNS examination, respiratory, cardiac, and also your abdomen. Okay. Then comes local examination. In local examination, we examine under three headings: examination of the breast, examination of the abdomen. Okay, so this is in case of ANC case. There are two headings: breast and abdomen. In a PNC case, we also do the local examination for the episiotomy, incision, and all that. Right. So in this, in the breast examination, you have to look for nipple, areola, complex, for the skin, any dilated veins. Okay, colostrum won't come over here. So this was for a PNC case, right? Overlying skin, any breast tenderness if present, all that has to be seen. Then in case of abdomen, you have to see inspection and then palpation. Inspection, all the points you know, and in palpation also you have to do first superficial palpation, deep palpation, check for temperature, and then uterus size, that is a fundal height in centimeters, you can calculate from the pubic symphysis. And you have to go for all the grips, that is leopal, first grip, then that is also called the fundal grip. Second grips will be the lateral grips, right lateral, left lateral, and then the third grip will be the pelvic grip, and then there will be a fourth grip also. So all these grips you have to do properly, because they can ask you to perform in front of the examiner to show them the grips, and with the help of that they can ask you that what do you think about the lie, about the presentation, which is the right side, which is the left side of the back of the baby, all that, right? Then whether the fetal head is engaged or not. Then you have to also hear for the fetal heart sounds, the side of the heart sounds, right? The spino-umbilical line on the right side or the left side, in your case, whichever it is, the site, then the rate, heart rate, the rhythm. And finally, you also examine for scar tenderness. So if there is a history of previous this one C-section, right? So you have to check for scar tenderness. So in scar tenderness, I hope you know how you have to go about. For example, this is abdomen and this is the umbilicus. So scar, what many people they make a blunder is that you will see a linear, for example, a linear incision was given. So a lot of people they will start to palpate along this line and they will say that yes, we are checking for scar tenderness, because this is wrong. Why is it wrong? Fundamentally because this vertical incision and this scar that you are seeing, it's a superficial scar on the skin, and scar tenderness means the scar means the incision which was made on the uterus, and in uterus most of the times the incision which is made is a transverse incision. So you have to, when they ask you to check for scar tenderness, you have to check it in a transverse fashion in the lower side, and not like this for the superficial skin scar, right? Now after this, certain things to be given as an advice to the patient. This is also a very important part. Many of us we skip over this, and then later when the examiner comes and they ask the women that this junior doctor, what all advice did she give to you? And then they are like, no, she said nothing, literally. Yes, because we know the patients are also very non-cooperative many of the times. Yes, so you have to give advice, very clear cut advice, so that the patient will tell the examiner that you gave it. So first, if it's an ANC case, the woman has come for a visit or for any complication, so you always have to tell her and motivate her to go for an institutional delivery. Then about the diet, if there, because you also calculated, right, if there was any caloric deficit or any protein deficit, so ask that what all changes, modification in the diet or increasing the frequency of meals has to be done to make for that deficit. Then proper water intake, and also the clean water free from contamination. She can drink boiled water if there is any history of prior like jaundice, gastroenteritis. Then hygiene has to be maintained, and always you have to motivate her to keep taking iron tablets, because there is a very poor compliance for this, and other vitamins also, folic acid, calcium, to take rest and sleep, and not to lift any heavy weights, to take care of ourselves, okay, and proper flat footwear to be worn, all these special things to be kept in mind. And you also have to motivate the woman for a copper T incision right from this time. It is said, right, in PSM also we study that from the ANC period only, when the woman is coming to you for ANC visits, she is more receptive, she is more calm down. So all these advice, contraceptive advice, institutional delivery, care of the infant, breastfeeding technique, everything you should start from an early period, so that the woman is more receptive, she has more time to learn and to accept these things. So copper T insertion, it can be done at 5 different times, okay. So depending on them, we have kept certain sweet names also. For example, menstrual insertion, or abortion after an abortion. Postpartum incision can be done post placental in case of cesarean section, and post coital copper T insertion, which is done as a part of emergency contraception. Right. So with this will be most of the things we have covered more or less in ANC case history and examination. So thanks a lot for watching, and if you think there is anything that we missed, so please do mention in the comment section below, and have a great day.